Okay, good afternoon, ladies and gentlemen. I think we will make a start. A very warm welcome to this session, this panel discussion entitled Globalisation, its impact on nurses and their nursing associations. My name is Howard Catton. I'm a newish member of staff at ICN responsible for policy issues, and it's very good to some familiar faces and some new faces, so hi to all of you. I just want to say up front that we absolutely have deliberately put this topic on the agenda. For some it's a very controversial subject. There are people who have may have extreme and very differing views. It's an issue which has become political over recent months as well, but there's no doubt that it is impacting on nurses, nursing practice, and the work of our associations. And that's why I'm particularly delighted to have such a strong panel of leaders of associations from around the globe. And to have 5 presidents as well. I will be the president's man this afternoon. I thank you all for your time, not just in being here, but also the preparation that I know that you've given to this afternoon. Let me just introduce the panel from your right. Firstly, Grant Brooks, President from the New Zealand Nursing organisation, followed by Dorothy Ngoma from Malawi, President of Malawi, and then Viva Kuvest from Denmark, who's the President of the Copenhagen region of the Danish Association, Barb Shellyan, President from the Canadian Nursing Association, and then Andy Gickenbarger from Rwanda, the President from his association as well. There is one panellist that is missing, and I just wanted to share a little bit about the panellist who we'd invited, and until just a few days ago was intending to be here with us. And Ibrahim comes from Bahrain and from the Bahrainian Nursing Association. And we have been working with the Bahraini Nursing Association over the recent months. They've been in Geneva and we've had some meetings. And ICN, I had the pleasure of going to the International Labour Organisation with Ibrahim as well. And the reason why he was keen, I was keen to have him on the panel, was to talk about human rights issues from the perspective of the National Nursing Association. Some of you will be familiar with events that occurred and the situation in Bahrain and the situation that put some of the nurses and leaders of that association in. Very, very briefly, if you recall some of the Arab Spring uprising back in 2011, there was some anti-government protests. And nurses and people from the Bahraini Nursing Association offered care to some of those protesters who were injured, who were participating in a peaceful protest. As a consequence of offering help and assistance, a number of, not just nurses, but nurses and doctors and other healthcare professionals were arrested. Some went to jail for between 5 and 15 years. Those longer sentences have been commuted and people have been released. The funding for the Nursing Association was seized, which has made it very difficult for them to continue. They still continue to operate, but it's under some duress. There are difficulties with them travelling as well, and clearly there are very significant issues about deterring nurses from providing care to people because political considerations at the time, but also that presents real challenges in terms of all of us who work under a professional code of conduct and what the requirements and responsibilities that those are to deliver care to people who need it in front of us, regardless of their situation. And a number of the nurses from Bahrain, whilst they're out of jail, out of prison, are still struggling to get work. And the meeting that I attended with Ibrahim in Geneva at the International Labour Office was to talk to them about why those people were still, it appeared, being barred from getting work as nurses in Bahrain. And Ibrahim was very, very keen to be part of this panel and to say more about those things. But I just wanted to acknowledge him, and I wanted to acknowledge the work of the Bahraini Nursing Association, and to stand in and thank you, because that solidarity, I will make sure that I convey that back to him after the event as well. And if I can get a picture or two as well from those that are taken, I will send those to him and tweet them from the ICN account, because I know that we did some of that before, and they found that very, very useful. So thank you for that. What I'm going to do is to ask each of the speakers are going to make some introductory comments. Some are going to come to the podium, some are going to stay seated. And then once we've had all of those contributions, I'm really keen to, it's a discussion, so to open it up to you as well. So I'll facilitate that when we get to it. But firstly, our speakers, Grant, sir, over to you.
Kia ora and greetings. Thank you for the introduction, Howard. My name is Grant Brooks, and I'm the co-president of the New Zealand Nurses Organisation. I'd like to thank Howard and ICN for giving us the opportunity to participate in this panel today, and I'd also like to greet my fellow panellists, Dorothy, Vibeke, Andre, and Barbara. Our organisation is both a professional association and a union, which represents 48,000 nurses, midwives, nursing students, kaimahi hauora and health workers on professional and employment-related matters. The NZNO is affiliated to the ICN, obviously, and also to the South Pacific Nurses Forum, Global Nurses United, and the New Zealand Council of Trade Unions. Our organisation embraces biculturalism, which is the partnership between the indigenous Māori peoples of Aotearoa, New Zealand, and those who've arrived more recently of European and other ancestry in the last 2 centuries. But in the words of the whakatauki, or ancient Māori proverb, we're all in the canoe together. Our association believes that globalisation will be felt by nurses and NNAs in 7 main areas: workforce mobility, immigration, technology and telehealth, population displacement and climate change, workforce development and regulation, trade and investment agreements, and in the influence of ICN and member NNAs. Regarding workforce mobility, health workforce shortages globally are predicted to continue. Workforce mobility is also set to continue, and reliance in some countries on internationally qualified nurses, or IQNs, is likely to continue as well. If it's allowed to persist, the health workforce shortages will increase inequities in access to healthcare, causing preventable illness, disability and death. And they will also threaten public health, economic growth and development. And these key points were all highlighted by the High-Level Commission on Health, Employment and Economic Growth last year. For our association, our publication on IQNs and immigration was published in February, and it notes that New Zealand has the highest dependence on migrant health professionals of any OECD country. We have very low retention of health professionals, and there's a high percentage of churn among our IQNs, both in leaving our country and leaving the sector they were employed and recruited for. The next slide indicates our association's response. Long-term planning for a sustainable nursing workforce in today's globalised world should include a commitment to employment of new graduate nurses. In 2016, only 57% of the new graduates from New Zealand education institutes were employed through the Advanced Choice of Education scheme. We also need meaningful IQN retention strategies. And these should include accessible and affordable competence assessment programs, security of working visas, for example, freedom from revolving renewals, and supportive work environments, including safe clinical environments, equitable remuneration, and freedom from xenophobia and racism. Technology is the fastest growing enabler of healthcare delivery. Technology transcends borders, and thus its global impact on nurses, on nursing practice, and on our associations is inevitable. The way in which consumers or patients use technology as an enabler for their own self-care will also impact on nursing and influence future models of care. Technology and telehealth will also change the notion of place and presence. Consequently, nursing care may not be provided in the traditional way, face-to-face. It may be provided across national boundaries, and this raises regulatory concerns. To influence the direction within New Zealand, we have also developed a position statement, Nursing, Technology and Telehealth, published last year. According to the High-Level Commission on Health, Employment and Economic Growth, the number of political conflicts globally increased over the last decade by a factor of 100%. The number of people displaced due to conflict increased from 37 million to 60 million, mainly in middle-income countries. Between 2008 and 2014, natural disasters displaced 184 million people. Within conflict zones, healthcare workers and nurses might become deliberate targets. Nurses in our associations will need to become more prepared, educated and trained to work with displaced populations and refugees, including provision of nursing care in conflict zones. Regarding climate change, our association published a position statement last year, and we've since divested our funds from fossil fuel companies. The communique of the 2016 South Pacific Nurses Forum, which we attended, also identified population displacement as a result of climate change, along with migration, education and regulation, as key areas for attention. The members of our organisation frequently respond to disasters in the Pacific caused by extreme weather events. To succeed in implementing the Agenda for Sustainable Development through SDGs and poverty reduction, equality education, decent work and inclusive economic growth and gender equality, we potentially will see a shift in workforce development away from narrow specialisation to broader and lifelong building of competencies. Nursing workforce development, education and training would like to have a strong emphasis on early intervention, community-based care, primary care, population health and public health promotion. This will be complemented by improvements in advanced nursing practice to improve access to health services. Likewise, our associations are likely to change their focus to support a broader approach to workforce development, but will continue to ensure that this results in decent jobs, working conditions and pay for health workers. Globalisation does require NNAs to engage more in political commentary. Some governments are responding to globalisation by entering into trade and investment agreements such as the Trans-Pacific Partnership Agreement, and these have potential negative impacts on economic inequality and other determinants of health, on health policy, funding and access to medicines. Nurses and our NNAs will need to promote intersectoral collaboration at local, regional, national and international levels in response. We have a general election coming up in New Zealand, and our political commentary this year will be based on our election manifesto, which identifies 7 priorities. Sustainable nursing workforce used to its full extent, investment in public health, a primary care approach to improving population health, best start for children, safe clinical environments, fair employment and social and health equity. I will conclude by saying that globalisation will require multi-level engagement to address the 7 areas highlighted in this talk. nurses and our associations will need to be adept at managing the impact of globalisation. As the High-Level Commission on Health, Employment and Economic Growth stated last year, no single agency and no single sector can implement the changes required to achieve a fit-for-purpose health workforce in the context of persistently high unemployment and underemployment in many countries, and amid major demographic, technological and socio-economic changes across all countries. Political will, leadership, intersectoral action and international partnerships will be critical to success. Thank you.
Thank you very much, Grant. We'll move straight on. Dorothy, over to you, please.
Thank you. Good afternoon. My name is Dorothy Ngoma from Malawi. Malawi is in the southern part of Africa. I represent a union with 12,000 nurses for a population of 17 million, a small country. And of those 12,000, only 4,000 are employed by government. And so we work, the nurses, they are working very extremely difficult environment. I will continue by highlighting a number of areas where we feel we, as nurses in Malawi, globalization has impacted us. Most of our concentrate on the positive areas and a few areas that we believe we have been affected negatively. I'll start with the aspects of partnerships and globalization in nursing and generally the health of Malawians. We believe that globalization has contributed and facilitates strengthened partnerships and collaboration, especially through ICT-enhanced communication through various media such as Skype, phone, internet, emails, and others. And as such, our NZNO has utilized technology to deliver healthcare and strengthen partnerships and collaboration, including the visitations. We've had quite a number of partnerships, the current one being our partnership with the Norwegian Nurses Organization, which is very strong, who have supported us for the past 10 years. And of course, we have had other partnerships, between us and nurses organizations in the North and West. In the same area of information, communication and technology, here I'm thinking of telecommunication activities. Of course, these are very important and have been integrated appropriately into the overall policy and strategy for the development of nursing practice and the provision of nursing services, education and training of nurses. And through this e-learning and digitalization of content and images have contributed towards improving nursing education and learning, resulting into improved practice and professional and career development of the Malawian nurse. Further e-learning has provided a mutual balance to nurses in the context of constraints of time, money, staffing shortages, as I have highlighted, general work, and also the family balance, because in the past, nurses have had to leave their families maybe for years. I, for example, left my family for 2 years to go to Kenya for advanced nursing years back, and then I had to leave again for 2 years to go to the United States for my master's degree and to left small children. But now it's not necessary to do that because we are able to connect and learn at home through the e-learning and using internet and all that. So this has impacted positively. And through this, we are able to get universities in the North and the West to connect with colleges in the south in Malawi to support nurses as they progress in their nursing education. The third area that I want to share is the aspect of the disease trends, prevention, management, and control of diseases, epidemics, and also healthcare emergencies. Globalization has resulted into us being in a global village where healthcare emergencies have also become a global issue, and especially where people have migrated, and this for us also calls for increased role of nurses and in timely intervention. Here I'm thinking of instances where we've had, for example, Ebola, epidemics of Ebola. Malawi currently has had quite a big scare of Ebola infection because it's getting nearer to us in the south, and therefore they need to be very alert because our borders are very porous. People just come in and get out, and also because we're extremely short of resources, that in itself there will be need for surveillance and public awareness, and it calls for active nursing participation and multi-sectoral collaboration and investment in time, financing, and of other resources, especially because we are in a country where probably we cannot manage on our own, but we definitely will rely on the support of those offshore up north west who can come in or be called upon, or yourselves be called upon to come and rescue or help in whatever way. And of course the issue of climate change, that also has brought a lot of problems, including floods. We've had heavy floods that has contributed to hunger, food shortages and so on, and therefore we've also been involved into supporting those communities. And I remember once even the Norwegian nurses had to come in, fundraise and support our communities, including the nurses that were affected. Another very important area is the international trade agreements, which also affect the health financing of our country. So the health sector is currently increasingly influenced by the bilateral and multilateral economic policies and agreements that are signed internationally. These are negotiated agreements that generate both opportunities, but also may affect nursing and healthcare in general negatively. Here I'm thinking of, for example, the IMF and the World Bank requirements, where ceilings are set. So Malawi, for example, currently is not able, even though we are extremely short, one nurse taking care of 50 patients, 100 patients, we cannot recruit. For the past 3 years, we cannot recruit any more nurses. And that is because of those agreements and the ceilings that are set, and there is little we can do. And so that's an area where, of course, Malawi continues to lobby and advocate. And related to that, a few years ago, my organization, the Nurses Union, had to really advocate heavily to the British government, because about 8 years ago, Malawi lost 50% of its registered nurses and midwives. 50% left the country in a period of 5 years in search of greener pasture. And because the North and West, and most of them went to UK, they were offering better packages. But then what it did was it depleted a whole level of nurses that we couldn't afford to lose. And we had to lobby really hard with the British government, and of course eventually they put up, they supported Malawi by topping the salaries by 52%, and that stopped the nurses from leaving But what that also did is that, because that was an agreement for 5 years, at the end of the 5 years, 2 years ago, Malawi government was not able to sustain that. And they were going to remove that 52%, so we had to fight, and we are still fighting to date to make sure that Malawi government does not remove that support. So although the nurses have stopped trekking, but of course now they are moving out of the government system, and so we continue to be affected. Another area that we have, of course, benefited from this globalization is the training of nurses and midwives in country. We have had partners supporting our government in the training. But we've had those numbers, they've been trained, but the issue now is how do we retain them, and then how do we also make sure that they are employed and they provide the services. What I see happening now is that all these nurses, if they don't get recruited, they are going to go back to UK, US, Australia, Canada, and then it's like we are going back to where we are coming from. And therefore, it's an area or there are issues that we need to continue discussing with our partners, colleagues, and making sure that we continue getting that support. In conclusion, we are saying that we, as nurses, living in this dynamic global village, and therefore nurses and their organization should embrace globalization and generate value while mitigating the many challenges that we continue to face every day. Thank you.
Thank you very much, Dorothy. Aziba.
Hello everybody, and thank you very much for ICN putting up this topic, and then on behalf of the Danish Nurses Organization, we're very glad to contribute to this discussion. My name is Vibeke West, and I'm the local president for the Copenhagen area, and I've been involved in the Danish Nurses Organization for a very long time. I also have another issue which I'm on the board for UNICEF in Denmark, so we kind of go into other fields as well. You've asked us to reflect on the follow title, Globalization, its impact on nursing and their associations. So let us look at what globalization actually is. It is a process of interactions and integration among people, countries, companies and governments of different nations as well. A process driven by international trade and investment and aided by information technology. This process has affected on the environment, on culture, and on political systems, and on economic development and perspectives, and on human physical well-being in societies around the world. Globalization means also a lot of foundations and money are going in between countries. Not only countries make their decisions, there's a strong economic things that actually turns around the things, like for instance, the Clinton Foundation, a lot of foundations is actually taking on where government is taking over, used to take over. As the rest of the world, Denmark are facing some of the challenges, but not as serious like other countries you're from. But we face a democratic change. For the first time in history, the population of people over 60 years old and older outcome the population of children under 5 in Denmark. We face more people with a lot of diseases, and most of them due to that they have a very unhealthy lifestyle. Due to advanced technology, we face new, fast-changing treatment and care. This means a growing expectation and increasing demand for the population for healthcare. As the largest group of health professional nurses are critical to meet globalization and its challenges and to transform the health workforce. There are 4 key areas where globalization impacts nurses. It is in education area, the profession, the way we define what a qualified nurse is and how we educate nurses. The second one is how we organize healthy globally and work together with it, about it. The third one is leadership and the way we look at leadership. And 4 is environmental issues. I have decided to focus on the environmental and health of nurses. This is an issue the Danish Nurses Organization has worked a lot around. We're not there, but we know that nurses in their professional life is very much into very strong ways that their work actually has an impact on their health and the way of how they can work. We also know that as healthier the nurses are and more glad about their work, it actually gives the patient outcome a much better result. The physics-social working environment is a huge problem, and many countries in Europe faces an increase in stress-related illness, and a lot of our nurses actually is in the same field. To ensure quality care, we need to acknowledge the impact of occupational health, both physically and psychologically. We have a nurse qualified job. We have to be working on this issue because we don't need that our nurses get sick. Working in the fields, we need them to be healthy, and in that case, they're much better provide the health care for the outcome for the patient. Looking at the role of nurses is providing safe patient care and satisfaction. Patient safety and work environment are closely related. It is 2 sides of the same coin. We need to think about new ways to improve nurses' work environment. Relationships plays a central role in nurses' work environment, job satisfaction, and also the way that we stay longer in the business and the way we kind of transfer the thing we work with to the new generations of nurses. This is a significant potential to improve nurses' work environment and well-being. In most cases, it can be done by focusing on improved quality, patient safety. Linda Atkin has addressed that many times. Handling changes, management, relationship, and social capital. Nurses generally have a very strong commitment to patient safety. I will end this short introduction with Margaret Chan's words she was the former director of WHO, with the words, "For too long, countries has seen health workers as just another cost to manage instead of an investment with a triple return for health, economic growth, and globally health security." I look so much forward to our discussion. Thank you for the word.
And now if I may invite Andy from Rwanda for your comments, please.
Good afternoon. My name is Andre Itembagara. I'm the president of Rwanda Nurses Midwives Union. First of all, I would like to acknowledge and thank the ICN leadership that has invited me to present on this hot topic, globalization, which is very interesting in our countries in Africa. Most of us can have different perspectives or definitions about this globalization topic, but I tried to find just a definition from Business Dictionary that's saying the worldwide movement toward economy, financial, trade, and communication integration. It's an interconnection and interdependent world with free market transfer of capital, goods, and services across countries or continents. Can we talk about economic flows? It can be either a foreign direct investment called FDI or foreign portfolio investment called FPI. Globalization has had the effect of markedly increasing international trade and, of course, culture exchange. How do we see the concept of globalization in Africa? Actually, Africa have been showing the growth in terms of economy with a GDP of 6.2% in 2008 and 5.8% in 2014. Actually, it has been decreased a bit, but we hope that's going to again increase. Africa growth results only for demand of export commodities and resulting high price of crude oil and minerals. Africa needs to develop its infrastructure, ICT infrastructure, and human capital. It needs to attract foreign investors in these globalization issues. We do have a number of health gaps in Africa. We are estimating now in 2050, 2.5 billion people. Many countries still contend with high levels of child and maternal mortality and malnutrition, as my colleague from Malawi said. Most health systems are not able to deal effectively with epidemics and the growing burden of chronic disease. These challenges call for renewed commitment and accelerated progress toward universal health coverage. Health worker shortage in Africa is another issue. The statistics that I have here from World Health Organization shows that in 2009 we were accounting about 0.55 nurse or midwife out of 1,000 people, which is very, very low. Health worker shortage in sub-Saharan Africa derives from many causes, including short of investment in pre-service training, international migration, career change among health workers, premature retirement, morbidity, and premature mortality. Workforce migration to Western and Asia countries, as my colleague said, it's another problem that even those that we are trying to train, we lose them in just a few years. But Africa is trying to organize in terms of economic regions. We are trying to organize these regions so that we can absorb ourselves, our workforce, and increase trade between countries and between regions. This is just a chart that shows different regions: South Africa, East Africa, West African countries, North and Central. Let me talk a bit about Rwanda, my home country. Rwanda have been, as everybody knows, has been gone under a genocide, which was a terrible genocide that took more than 1 million people. And it was really a challenge for the country that was, the country was like, there was not any infrastructure, any social investment. But after 1994, the country has been able to increase and investment in social investment for schools Rwanda was one of among the countries in sub-Saharan Africa that was able to achieve the MDG of primary education coverage. And in 2014, we are counting 97% of children, girls, and boys in schools. Actually, we do have 11 nursing schools, and we have more than 800 new graduates per year. And they say that we came from far because in 1994, the country was accounting only 400 nurses in the whole country. So we're actually counting more than about 14,000 nurses and midwives. So community health insurance actually is covering more than 90%. And we start a campaign of investing in manufacturing made in Rwanda. So this is one of the infrastructure developed in Kigali for hosting international meetings. It's a convention. For health professionals challenge, we've been able to train 14,000 nurses and midwives in just 20 years. But unfortunately, we are employing 9,500. And others, we don't know where they are. Either they immigrated, either they changed their profession. So professional migration within or outside the country is high, and the country capacity to employ new graduates is low. Career change among nurses is due to the inappropriate working conditions. They are changing career from nursing to other fields because of the working conditions. Professional associations or unions will have a lot to do. Firstly, we need to advocate for human resource in health investment, and this for our government to increase budget allocated to health human resource. We need to have a clear policy to retain and recruit qualified health professionals in practice. We need to improve the quality of education, and we need also to call for private investment in health infrastructure.